Welcome, Dental Office Compliance Administrators. This video segment is intended for compliance administrators in charge of implementing your program. During the 10 minutes, we will review the steps required to implement this OSHA and Hippa training program at your location. This course has been developed in accordance with the standards of the Academy of General Dentistry approved program for continuing education. Your clinicians will earn AGD PACE continuing education credits for attending this presentation and reviewing its coordinating OSHA and Hippa facility report or checklist, which explains in detail employee performance expectations and protocols. CE certifications will be provided in the areas of Federal Annual OSHA Updates, COVID Management, Current CDC and OSHA Infection Control Updates, Global Harmonization System, which is a standardized international chemical safety required certification, and Federal Hippa training as well. You will be emailed a link to access, customize, and print your team's CE certificates. If your doctor is an AGD member, please send us an email with the doctor's name and AGD member number. We will then enter that information into the AGD system. Compliance administrators, your team will need to complete 5 learning modules that we will list here. Please be sure to plan your 2023 OSHA and Hippa training time to accommodate all 5 employee training modules. Keep in mind that you can plan to complete these as a team or individually, in one session or in several sessions. Your employees will be able to access your private viewing portal to review all training modules per your discretion. Remember, they are licensed for use at your location only, for your employees only. Please make them available to your full and part-time employees and share them with new hires prior to their job commencement. You can obtain your sign-on credentials by referencing your course confirmation email or by contacting our administrative team. We suggest that you change your password and sign-on credentials should team members leave your employ throughout the year. This will keep your license portal materials safe. Whether you are a first-time participant of our initial OSHA and Hippa program or a returning renewal customer, your enrollment will provide you with comprehensive compliance coverage that includes all 5 required OSHA and Hippa employee training modules via our online portal access, customizable OSHA and Hippa manual modules with updates sent to you throughout the year via USA mail or emailed, all required OSHA and Hippa employee forms, also with access via our online portal, a recap of your employee training video in the form of an OSHA and Hippa facility report or checklist. Be sure to use this checklist to implement all compliance requirements. This will ensure that your facility is up to current compliance standards, and a customizable Hippa risk assessment report template, which is required and provided by our team annually. You can locate this year's required paperwork in either your hard copy manuals, on our portal, or they will be delivered via postal mail. New customers, your important documents will either be arriving via UPS mail. You will receive a big box of your onboarding required manuals and customized employee form packets. Or if you have chosen our electronic manual and forms option, you can access these by signing on to our portal. Returning customers, you will receive this year's OSHA required paperwork via email. Hippa paperwork can be found in the By Year Organizer, inside your blue hard copy Hippa manual, or if you have chosen to upgrade to our electronic Hippa manual option, find your documents by signing into our portal. Keep in mind that your customized manuals and employee documents are usually the first items that OSHA, Hippa, or health department inspectors will request and want to inspect. They will request this paperwork, as well as your safety data sheets and required sterilization and disinfection records. These documents must be produced within 5 minutes of their arrival at your office. And not having these documents ready at your fingertips can elicit hefty fines. But don't worry. With the hard copy manuals that we send in the mail, plus access to our OSHA and Hippa online smart portal, you will have instant access to all of your important documents and training videos. Just make sure that all of your team members know where and how to locate these quickly for inspectors. There are just a few more administrative details to discuss before you'll be ready to start hosting your employee training session. First, keep in mind that there are several states that require additional state OSHA protocols. If you see your state listed here in white text, we will provide you with special access to your state-specific required paperwork via our online state-specific OSHA update portal. After this video training, you can gain access to that private portal through our website. you will be able to view and print your state-required documents. To enter the portal, go to dentalenhancements.com/state. Enter the password in all capital letters, MYSTATEOSHA. Please print or scan all state-required documents, fill them out, and place them in the state-required forms section of your OSHA manual to house these documents. Please be aware, if you practice in Michigan or Texas, you'll have some bigger, bolder state compliance requirements. Texas viewers, please be aware that you need to update an additional state Hippa certification biannually. And Michigan dental professionals must implement additional Michigan OSHA standards. If you are non-compliant for either of these, please call our office to obtain them. And finally, don't forget, it is required that every year, all of your employees will have to complete a training update to your federal OSHA and Hippa obligations. Why? Because laws change, diseases change. There are national worldwide disasters and technology updates. Our team continually studies these changes, and throughout the year, we will provide you with update alerts via phone, fax, email, and hard copy reminders and updates. Please do not ignore our update reminders. Nominate someone in your office now that will be assigned to call us back to find out details on all updates so that we can keep your office up to date and safe from non-compliance status. To help your team stay compliant year after year, we invite you to pre-book your compliance update session for next year. Pre-booking ensures that your office will stay in compliance year after year while earning all of your required compliance CE certificates. You will be able to rest easy and enjoy big savings with our pre-booking discounts. Make sure to get you enrolled by calling us. Then all you have to do is save the date. Next steps. If included with your purchase, be sure to check the date of your administrative phone sessions. Only your chosen compliance administrator needs to attend these mentoring sessions. If purchased, a compliance coach will help you to secure and organize all of your required paperwork and show you how to access your OSHA and Hippa training portal. Make sure all of your employees watch the 5 required compliance modules for this year. You can find your sign-on credentials in our portal in your course confirmation email. We will also issue your course completion CEUs via email. Next, make sure to block off time for customizing your OSHA and Hippa manuals, and definitely be sure to have your employees sign their required paperwork for this year. Then file your completed employee paperwork in the by-year organizers, located in the back of your OSHA and Hippa manuals. This way, you'll be prepared and ready for any compliance inspection. Finally, make sure to print and implement all of your required updates that will be listed on your customized OSHA and Hippa reports. With all of these wheels in motion, your team will be safe, compliant, and successful. Thanks for investing the time to listen to this brief administrative overview. Hello and welcome to your OSHA, GHS, COVID, and Hippa employee training for 2023. Today, this training course will be presented in 5 modules. First, we will review COVID management updates. The main focus here will be employee safety, current PPE guidelines, and environmental safety protocols. Keep in mind that pandemic protocols will continue to evolve. We will provide updates to these throughout the year, posted on our website and through emails to your office. Next, we will review updated chemical safety standards that should be in practice within your dental facility. Your hazard communication plan has now been scaled to an international standardized chemical safety program called Global Harmonization System. GHS has been required in the USA since 2016 and must be implemented and fully functioning within your office. Next up will be your federal annual OSHA employee training review that will include the history of OSHA, occupational exposure risks, blood-borne pathogens, hazard containment, workplace safety, and essential health practices. We will finish up your OSHA instruction with a mindful focus on infection control. Reviewing the most up-to-date CDC OSHA-enforced surgical-grade sterilization and disinfection standards that are currently required in all dental offices. Finally, we will review in detail your federal Hippa obligations with regards to privacy and security for handling and properly protecting your patient health information. COVID-specific updates will also be included. Clinicians will earn several AGD or PACE continuing education units after completing these 5 modules and a simple quiz on the modules. Be sure to ask your compliance manager to redeem your CEUs using your emailed link. CE certificates can be saved as PDFs and printed for your convenience. Module number 1. This section will provide your 2023 COVID Management Employee Training Updates. By now, we all have been educated in the signs, symptoms, precautions, and dental practice management protocols that relate to the safe management of COVID-positive patients and employees. This section will provide a review and update of dental office requirements and clarification on current methods for monitoring patient and employee symptoms, the importance of continued use of proper PPE, properly managing the environmental spread of bioaerosols, and future expectations within our profession. As the COVID virus continues to spike and recede, it is necessary during high community incidents or to safeguard others from symptom exposure to continue to monitor and document COVID symptoms of both patients and employees. Follow these simple steps to comply. Ask patients if they have symptoms prior to seeing them in your treatment rooms. Monitor employee symptoms during spike. This can easily be accomplished by keeping a simple daily or weekly log of employee COVID symptom status. Management should be sure to keep track of this confidentially. Document your findings. Inspectors are likely to ask for proof of employee and patient monitoring. Make sure you keep logs or chart entries. These do not have to be complicated. Make them as simple and streamlined as possible. Taking temperatures of patient and employees will be required during times when COVID is spiking within your community. For clarification, check with your local health department to see when and if temperature monitoring is to be enforced. Remember that based on the CDC's classifications for occupational risk, dentists, hygienists, and dental assistants continue to have the highest exposure risk for acquiring COVID or any bioaerosol-type disease. This is due to the prolific exposure to infection microbes during aerosol procedures. With this in mind, let's take a look at the present OSHA standards with regards to wearing, caring for, and disposing of personal protective equipment. You can visit OSHA's website for current dental workplace directives. Here you will find specifics for what is expected to be implemented within the clinical dental workspace. This table shows clearly that clinical gloves, full circumference eyewear, face shields, and lab coats or gowns are required as basic expectations. Important clinical treatment distinctions are made between non-aerosol and aerosol procedures and need to be understood by all clinical personnel. Only for well patients during non-aerosol procedures can a traditional Class 3 surgical mask be worn. For suspected or known COVID-positive patients and during all aerosol procedures, a NIOSH or equivalent approved mask must be worn. Check with your respirator manufacturer for more insight and guidance. Going forward and until further notice, surgical masks should be disposed of after each patient. For respirators, it is currently required that all USA employers supply NIOSH, which stands for National Institute for Occupational Safety and Health, N95 respirators within the dental clinician setting. You should consult with the manufacturer of your N95 regarding the maximum number of donnings or uses they recommend for your particular respirator model. If no manufacturer guidance is available, data suggests limiting the number of reuses to ensure an adequate respirator performance. If the respirator is visibly soiled, it should be disposed of and no longer worn. It is best practices during COVID to dispose of respirators and masks into a biomedical waste bag. To extend the life of a respirator, some clinicians like to cover their respirator with a surgical mask. Please note that this umbrella technique is not a favored technique per the CDC, who condones its implementation as a crisis strategy only, and clinicians will have to change the outer surgical mask after every patient. Keep in mind that repetitive touching of the respirator when changing the outer surgical mask may actually cause more contamination. Your office's respiratory protection plan administrator must determine if this umbrella technique is a needed strategy or more of a liability within your workplace. Your administrator must ensure adherence to all engineering controls to limit potential respirator surface contamination. Accomplish this by providing additional training to staff to reinforce the need to minimize unnecessary contact with the respirator. Adhere to strict hand hygiene, and review proper donning and doffing of PPE techniques. If your office plans to implement this umbrella technique, these practice guidelines should be clearly stated and added to your written respiratory protection plan. Let's review the guidelines for wearing NIOSH certified respirators. Referencing this current PPE preparedness checklist can be very helpful to ensure your practice protocol's current standards, especially as they apply to clinicians and respirators. Current updated requirements include having a written respirator protection plan applicable to pandemic protocols that is customized for your office. We include this customizable plan in our 2020 to present OSHA manuals. Ensure that all clinical employees are trained in proper donning, doffing, use, maintenance, replacement, and disposal of their respirators. Employees should also be provided a list of the benefits and risks of wearing an N95 or equivalent mask. All of the aforementioned should be listed on a voluntary disclaimer document that should be presented and then signed by each clinical employee. Contraindications from wearing respirators can include headaches, shortness of breath, dizziness, irritability, and lack of oxygen. If the respirator is not fitted properly, or if the wearer does not have the lung capacity to wear such a device. Employee voluntary disclaimers need to be kept on file, as OSHA and Health Department inspectors will ask to reference these. There must be an ample supply of the respirator masks readily available for each clinician. Each employee will be required to competently demonstrate a quick self-fit of their respirator mask. And annually, you should update and document your obligation to provide a respirator fit test to each employee. As a review, employer must offer NIOSH N95 or equivalent respirators, and employee must sign a disclaimer understanding the risks and benefits prior to use. Keep in mind that while OSHA law puts the onus of PPE selection on management to decide on the proper personal protective equipment to select for the various clinical and non-clinical situations within the dental setting, it is always best to dig deeper and be prudent when selecting PPE for your team. Of course, when COVID or other infectious diseases are in an elevated state within a city or county, PPE requirements become stricter, and practice owners are always held responsible to provide a safe workplace free from hazards or serious harm. The video that you see playing on your screen is an excerpt from a 3M demonstration video that features the steps required to properly perform an N95 fit test prior to having any clinician wear an N95 mask within the dental facility. If your dental office plans to use N95 masks during clinical care, you should also purchase the manufacturer's fit test kit. A fit test will take 15 to 20 minutes to execute and should be performed for each clinician prior to using an N95 mask. Read the manufacturer's directions thoroughly before starting. Use the head isolation helmet, nebulizer, and sweet or bitter tasting solutions that will be sprayed into the isolation helmet to test that the N95 fits the clinician with the proper required seal. Clinicians should also understand that every time the N95 mask is worn, proper donning and a quick test of the mask is required. The head and neck elastic straps need to be secured and flatly fitted. Applying pressure to the mask against the face, while taking several deep breaths, will test and secure the suction, fit to the clinician's face. It is important for all dental practice owners to understand and implement these guidelines. Before using N95 masks in the clinical dental setting, first make sure that all employees understand the precautions and risks of wearing an N95 mask. Have a written policy or disclaimer referencing the precautions. This disclaimer should be signed and kept within the clinician's file as part of your written required respiratory protection plan. There are also several best practices that dental practice owners should consider. If an employee desires to wear an N95 or equivalent respirator, but wants to be certain that their medical status merits wearing one, it should be best practices for the dental practice owner to offer the employee a respirator questionnaire, send them to a qualified medical practitioner to have a medical exam, and obtain written clearance to ensure their lung capacity is suitable to wear a respirator. And remember, for N95s only, An initial and annual fit is needed on each clinician and documented within your office's written respiratory protection plan by an office administrator. Going forward, keep an eye on industry leaders as they focus on new designs of dental respirator masks, especially papers, that may revolutionize our post-COVID return to clinical practice. Let's take our focus now to the dental office and operatory environment, specifically the precautions that can and should be taken to prevent the spread of viral bioaerosols. Presently, OSHA return-to-work mandates for COVID management will require your office to choose and implement additional environmental controls. You must list your chosen bioaerosol prevention modalities in your written respiratory protection plan. No particular modalities are presently required. We will keep you updated as requirements are sure to evolve as time moves forward. Paired with your clinical protocols, dental practice owners will need to research and implement the best practice options that will reduce your exposure to bioaerosols. There are modern dental suction systems, like the one you see here, that are designed to remove high volume of bioaerosol droplets, produced by high-speed handpieces and ultrasonic scalers during treatment. The wide-mouth suspended arm can be positioned to capture and effectively evacuate bioaerosol so that they will not contaminate the operator and environmental surfaces. This unit is designed with a medical-grade Hippa filter, precise water vapor filtration, and medical-grade UV light disinfectant system. The system that you see pictured here is portable. Stationary units may also be considered. Check with your dental supplier for more information. Installation of innovative HEPA medical-grade air purification panels, like the ones you see here, are a new standard. These can be installed inconspicuously within dental operatory ceiling panels. They work continuously to alleviate the invisible threat of infectious airborne pathogens with a zoned area. Most are designed to combine advanced surgical-grade HEPA filtration and ultraviolet light panels to provide fast, continuous air purification. While air purification panels are not a replacement for other infection control, cleaning, or disinfection protocols, they offer value-added air quality protection for team members and patients. Speak to your dental suppliers to learn more about these dental operatory air purification options. This hydrochloric fogger claims to reduce surface pathogens. Another smart aerosol containment practice is to consider the use of these all-in-one aerosol isolation systems. The one you see here combines high suction, saliva ejector, bite block, tongue shield, and oral pathway protector in one easy-to-use device. It's an intelligent breakthrough in isolation, especially during the coronavirus dilemma, and it delivers ease and comfort to patients, combined with peace of mind for better bioaerosol control for the dental clinician. Consider having all patients pre-rinse with an antiviral solution. Choose one that targets the viral lipid envelope of the SARS-CoV-2 virus. This may be helpful to decrease the virus's virulence. While there has not been sufficient time to provide evidence-based clinical studies on the kill rate for the coronavirus when using these solutions, many dental facilities are implementing this preemptive measure. And we reviewed some new and innovative considerations for managing bioaerosols and air pathogens within your practice. Now let's review what to do and what not to do to manage the COVID virus within your dental setting. Let's consider COVID SMART guidelines for your dental practice and the things you'll want to do as you transition through this. First, keep a close eye on virus updates. Follow the most current CDC, ADA, OSHA, and state guidance. Check our website. We will post useful tools that you can download and use for free. Remember to wash your hands whenever they are soiled. Wash for 20 or more seconds. And keep in mind that damp hands spread germs 1,000 times more than dry hands, so dry your hands off thoroughly. Also, hand sanitizers are not a substitute for hand washing at work. Follow the most current OSHA CDC infection control and housekeeping requirements with diligence. Wear all PPE appropriately. Follow CDC and OSHA mandates. Clinicians, suit up. Wear the maximum protective PPE, such as face visors, respirators, eyewear with side shields, hair caps, and full-length surgical gowns. Wash lab coats and scrubs at work if possible, or wear disposable lab coats. While OSHA requirements limit soft BMW waste to saturated items, now is a good time to implement best practices during COVID and toss all splattered soiled waste into your BMW red bags to maximize your safety. Confirm patient wellness prior to their appointments. Post appropriate COVID signs in your reception area and outside entryways that will help control patient flow. Showcase your infection control practices. As mandates change, implement all of these protocols. Patients and employees will notice and appreciate your commitment to safety. Now here's the skinny on what not to do with regards to the coronavirus. Don't ignore updates. Don't ignore infection control. Instead, unify and exhibit pride in your infection control efforts. All eyes will definitely be on healthcare facilities during and after this pandemic. Don't miss out on your regularly scheduled OSHA updates. New information and requirements will be the responsibility of every dental practice owner and employee. Look to our websites for timely updates and links. Don't take shortcuts with hand washing, personal protective equipment, or infection control. Be hypervigilant. Don't reuse PPE if it's disposable. Don't come to work if you are feeling sick. You will need to establish verbal and written criteria for screening all patients. Screen these patients well, and don't treat sick patients. OSHA's COVID Dental Web link has reminders about implementing current OSHA and infection control rules. Listed here are details of what is expected from all USA dental facilities. Provisions for making available proper-fitting personal protective equipment is critical. Reminders that providing a safe workplace free from hazards or serious harm is part of OSHA's General Duties Clause and the responsibility of every dental practice owner. OSHA and health department officials will be scrutinizing dental offices to ensure that you adhere strictly to the current infection control practices, as listed in this document. The CDC's Summary of Infection Prevention Practices for the Dental Setting. This is a 44-page document with 13 updated infection control requirements. This is a main focal point of all Dental Enhancements OSHA training sessions. Make sure that you have all 13 of these requirements implemented and running smoothly within your facility by now. You also have documentation proving that all employees have been trained to this level. If you need help with these, please reach out to us. When implementing OSHA policies, remember to always adopt the strictest policy when comparing federal versus state OSHA laws. 28 states have stricter guidelines. On your OSHA facility report, we will provide you with access info to our OSHA State Laws portal to review and download your state laws easily. Finally, OSHA reminds employers to adhere strictly to the current GHS chemical safety standards to protect employees as they may be using even more chemical disinfectants than usual. Again, use of PPE when handling hazardous chemicals is critical. Your team should anticipate updated OSHA standards related to our world pandemic. One such newer mandate is OSHA's 4013 mandate, to be sure to implement all of these mandates within your facility. Of course, you should maintain social distancing between employees while at work and encourage them to stay at home if sick. Work with a heating, ventilation, and air conditioning professional to ensure your dental office has optimal ventilation. This will safeguard and make certain that all AC filtration systems are fully functional, especially those shut down or operating at reduced capacity during the pandemic. Remove or redirect personal fans to prevent blowing air from one worker to another. Open windows as a source of fresh air whenever possible. Be sure exhaust air is not pulled back into the building from AC air intakes or open windows. Install HEPA filtration systems in high-risk clinical areas. When changing filters, wear the appropriate PPE to include a respirator, safety glasses, face shields, and disposable gloves. Make sure exhaust fans in restrooms are fully functional and are set to remain on. And finally, encourage employees to report any safety and health concerns to keep your workplace safe. First, it's important to acknowledge that OSHA does look to the CDC for their guidelines, recommendations, and summaries. In 2008, OSHA stated that since the Centers for Disease Control does all of the research on disease prevention and infection control, OSHA will enforce all of their findings as being the bare minimum standards, by which OSHA inspectors will measure and may issue fines for non-compliance. So, to reiterate, any CDC guidelines, recommendations, and summary is always the bare minimum OSHA standard by which to comply. During COVID-19, a dental office must also comply with the strictest directives issued from your state's governor's office, your state dental board, and your state health department. That means you must compare and comply with the strictest directives from the 5 aforementioned governing bodies. Don't get overwhelmed. Please visit our websites for current COVID-19 updates, useful links, free signs, posters, and cool tools. Dental teams, during this transitional time, it is even more important to keep your focus on infection control and disease prevention efforts. Let's face it, aside from normal dental phobias, COVID has surely presented new and additional fears from your patients, like the fear of catching COVID or other infectious diseases while at your dental office. As an added bonus for all-in-one DLX clients, we have included our COVID/infection control certification kit, complete with window decals, and a customizable wall certificate, proving that your team has diligently completed the current requirements for COVID management and infection control updates within your office. For renewal clients, an infection control achievement kit can be mailed to you once all required compliance components are completed. These provide peace of mind that patients notice and appreciate, and you've earned it. In total, your COVID pandemic preparedness obligations must include employee training and COVID certification, bioaerosol management, PPE updates on N95 or equivalent respirators, infection control updates, and required written COVID protocols, plans, and forms. Remember, if you need additional clarification or guidance, our OSHA compliance coaches will be happy to help. Just contact us. Our team is here to make the implementation of these new requirements streamlined and easy for you. This section will provide your hazard communication plan and GHS chemical safety protocols. In 2016, the USA protocols shifted to become OSHA GHS Global Harmonization System, which incorporates a standardized international chemical safety program for businesses worldwide. This section will focus on how to prevent injuries when handling work chemicals and professional products within your dental workplace. There are 4 ways you can get injured with a product or chemical within your dental workplace. You can ingest or accidentally inject yourself, absorb chemicals through skin or eyes, or inhale a product or chemical. And of course, if you have a reaction to any of the products or chemicals you are using while at work, let a coworker or management know and seek medical attention immediately. From 1994 to 2016, the USA used a hazardous communication plan in the workplace, designed to protect workers from chemical harm during work hours. Our USA HazCom program included 2 components. The USA's material safety data sheets that represented all chemicals and professional products kept on premises in the dental office. Doctors will need to retain these USA MSDS or a master list of the MSDS for 30 years as proof of chemical exposure over time. Next, there were color-coded hazard communication labels that coordinated with the MSDS sheets. These should have been placed at the point of use representing all professional products or chemicals you keep in your treatment rooms, lab, and sterilization areas. These USA HazCom labels can remain at the point of use indefinitely. These labels can serve as a great backup system in the event that your GHS setup proves to have imperfections. In 2016, the USA joined international efforts to implement the new Global Harmonization System. GHS provides round-the-clock monitors that will protect us better in the event of a workplace chemical exposure. Under Global Harmonization System, the USA MSDS sheets convert to standardized international safety data sheets. And the color-coded HazCom labels of the USA have now changed to these red diamond pictogram symbols. Manufacturers place these on all hazardous chemicals. If your practice was in operation prior to 2016, practice owners should retain USA MSDS or the equivalent master chemical list for a total of 30 years. Now let's talk more about GHS, your dental office obligations, and how to implement them now. What is Global Harmonization System? It's an international approach to creating standardized chemical safety in workplaces worldwide. Businesses throughout the world who have professional products or chemicals on premises participate in GHS. The USA was the last to join 62 other countries who have been on this system for over a decade. Global Harmonization System was created in 1992 during the United Nations Conference on Environment and Development, often called the Earth Summit meetings. You can read the GHS standard in more detail by visiting the OSHA website at osha.gov and searching for the GHS document, also known as the Purple Book. In the United States, we really needed this update because until recently, we had 6 different labeling systems operating simultaneously throughout our industrial and healthcare sectors. Before GHS, the USA was disjointed and inefficient with regards to handling chemical emergencies. And we have over 945,000 hazardous products in this country. We were a mess. GHS improves workplace safety by standardizing the way hazardous chemicals are labeled. This makes it easy for anyone in any industry to quickly identify the hazards associated with work chemicals. Under these GHS standards, we unify to establish more effective environmental guidelines that help us to prevent explosions and fires while in the workplace, and physical and health guidelines that help to prevent cancers, burns, and chemical injury while at work. Let's learn how to locate and distinguish the International Safety Data Sheets. The SDS are very uniform in design and easy to navigate. You can always distinguish an international SDS from a United States MSDS sheet by 3 distinctions. They are always labeled at the top with the title, Safety Data Sheet. If the product is hazardous, you will find a red diamond pictogram symbol on the SDS, and a P30 emergency identifier code will give you bullet point instructions on what to do in case of an emergency. Since June of 2016, manufacturers and dental suppliers had to make all SDS electronically accessible to the dental office. All new international SDS should be properly retained on file within your dental office by now. How are you supposed to convert the USA's material safety data sheets into the international version? Let's review those details now. The GHS mandate requires you to do 3 things. First, save your USA MSDS sheets or master list for 30 years as proof of exposure to chemicals. Next, the GHS standard requires you to locate and then save your new international safety data sheets in 2 varying formats. You must choose 2 of these 3 formats: paper, digital, or cloud backup. Why do you need 2 copies? In case your paper or digital copy ever gets damaged, let's say in a fire or flood, you would need to be able to go directly to your digital or cloud SDS copy for an instant reference. OSHA inspectors will expect that all of your team members can locate your digital or paper copy of your SDS within 5 minutes. Make sure that every employee knows where these safety data sheets are kept. Your backup cloud SDS internal library must be accessible to your employees 24/7. This is useful in situations when an employee may have to go to an emergency room after work hours in response to a reaction they may be having to workplace chemical exposure. What are some choices for SDS backup within 24-hour access? There are 4. Make a hard copy available with 24-hour access to the office. This option is also most efficient to present to an inspector. It is a great idea to have a hard copy available within your office. You can print your own copy or take a zip file of your SDS that you obtain from your dental supplier to an office supply store to make you a 3-hole punch copy to keep in a 3-ring binder. Create a digital PDF copy on your computer desktop. Your dental supplier is required to provide you with electronic copies of your SDS. Usually they can provide these in a zip file that you can store on your computer's desktop. It is important that all employees can locate this digital desktop copy in case of a chemical emergency or if an inspector asks. If you choose this digital storage option, make sure all employees know where the digital SDS folder is located and how to open and navigate it. Jump drive backups are another digital option, but can be cumbersome because they need to be distributed to every employee and updated regularly. Another great choice is to create an SDS Internet library from your dental supplier's website. Many suppliers provide this for free or for a fee. Or you can create a free SDS cloud library by using googledrive.com or your own cloud backup copy. Let's walk through the process of setting up a supplier's and a free SDS internet library. Let's go through a typical free dental supplier SDS library setup. First, sign on to your online account. Next, click into the area where you can complete your ordering. Now select a date range in your order history field. Make sure to go back into your order history as far as you can to include all SDS in chronological range. From here, there is usually a button that will prompt you to save all SDS to that dental supplier's internet library, as well as onto your computer's desktop in a folder. It's best to rename the folder to include the date it was set up. You will need to update this folder at least once per year. It's easy to update if you have the last saved date on it. Then print all SDS. Store them in alphabetical order using a 3-ring binder. Remember, you can ask your dental supply rep for help when executing this SDS library setup. If you are not using a dental supplier that provides free SDS storage, you can create a free SDS cloud storage solution with Google Drive. Simply register with a new email address and create a password for free cloud storage on their websites. First, you will need to search out all of your SDS from your manufacturer or distributor websites. Save them to a desktop folder. Then upload them to googledrive.com. It's that simple, and it's free. Remember to save a secondary copy of your SDS, as this is a GHS requirement. You can print or store a digital copy. Make sure the copy is easily accessible for your team. Finally, a master list of products is required to accompany your SDS library and manual. Don't forget to share your sign-in and password credentials with all team members. And you may want to change the password from time to time, or as you have employees leave your employ. All of these screenshots are provided within your GHS guidebook for quick, easy reference and step-by-step instructions when you are ready to set up your SDS backup storage solutions. To review, remember to save your USA MSDS or a master inventory list for 30 years. Replace USA MSDS with International SDS, and create a working copy of SDS and an easily accessible backup copy that is available 24 hours a day to your employees. Now let's talk about the pictogram labeling system under GHS standards. Under GHS law, manufacturers are now required to label all hazardous chemicals with universal pictogram symbols. Employers must display these pictogram symbols in English during all shifts to reflect the product's safety. Employees must take a GHS safety course to become certified in understanding the meaning of all pictograms prior to starting a job and handling hazardous products. This will ensure safety at all times. These pictogram labels contain both words and symbols. There are over 20 common pictograms used throughout the world. They represent physical, environmental, and health hazards. In dentistry, our GHS certification course will focus on the 8 pictograms that are commonly used within our industry. Pictograms have 2 signal word descriptors. Danger represents severe or fatal hazard, and warning represents a lesser hazard including eye, skin, or lung irritation. Under GHS, your dental product labels will look like this. Name of product, danger is the signal word here, and this is the pictogram representing corrosive. It's a very creative little symbol, depicting on one side a test tube dripping chemicals on a hand to signify a chemical burn to skin. On the opposing side, chemicals dripping on a surface to signify a surface chemical burn or etch. This is the most common pictogram in dentistry. You will see it listed on your bonding and etching agents. Now let's identify and get certified on 8 pictograms you'll see referenced in a dental office. First, we have explosive, which shows a firecracker bursting inside of the red diamond. Next, we'll see flames for our flammable pictogram. The next pictogram is a bit more difficult to understand. The oxidizer pictogram is supposed to represent, in the presence of oxygen, there can be combustion. For learning purposes, we will place a 2 in the O to represent the chemical symbol for oxygen. So, O2 plus fire equals combustion. Next, we have a gas under pressure, which will represent our nitrous and oxygen tanks within the office. These can be explosive if they topple over. The next pictogram is the traditional skull and crossbones that we all know represents poison. This pictogram under GHS represents severe toxicity. We have already learned the corrosive pictogram that we know represents chemicals that can cause burns to either skin or surfaces. This is carcinogenic pictogram, which shows a starburst put on the chest. This one is also a little difficult to understand. For learning purposes, during our training modules, we will mark it with a C to help you remember this is a cancer-causing pictogram. The last pictogram we have is an exclamation point to represent acute toxicity that is considered harmful. You are required to post a pictogram diagram within your office. 2 of these diagrams have been provided in your kit. They are in the front pocket of your GHS guidebook. You are required to post them within your office. It's a good idea to post one in your break room and one in your sterilization area. Keep in mind that there can be 2 situations in the dental office where you will have to create your own pictogram labels. One will be if you take tiny items out of a box to store at the point of use. If the original box has a pictogram symbol on it, you will need to recreate that pictogram at the point of use. The other situation will be if you re-pour products or chemicals into secondary containers. In this course, we provide 2 options for your pictogram labeling obligations. There is an easy way for you to make pictogram labels. In the back pocket of your GHS guidebook, we have included a pictogram labeling kit that consists of pictogram labeling sheets and page protectors. From our master copy, you can print as many as you need. Place them inside of the clear plastic page protector and keep them in all treatment room, lab and sterilization area, cabinets and drawers where you store point-of-use products. Remember, you will only need to use these pictogram labeling sheets when you re-pour an original product with a pictogram into a secondary container, or when you unpackage very tiny unit-dosed items with pictogram indicators. In these situations, you can list the product information on your pictogram labeling sheets. Place the sheet into the clear plastic page protector, and tape or lay the sleeve in the cabinet or drawer where the product will reside to represent your point-of-use items appropriately. This is a quick and easy way to get and stay labeled for the lifetime of your practice. These instructions and labeling sheets can be found in your GHS guidebook. For more instructions on how to set up your point-of-use dental products labeling system and pictogram requirements, look to our GHS guidebook for directions. We did it! We conquered all there is to know about your pictogram labeling and SDS facility requirements. We hope this brings clarity and insight to your GHS obligations. Module number 3. The section will provide your team's 2023 Federal OSHA Employee Training Requirements. Now we will review these required areas of Federal OSHA compliance. Your Federal Hazard Communication chapter was just presented with your International Global Harmonization System certification. These 2 now become blended, as the U.S. has now joined the international standardized efforts for chemical safety. Next, your Exposure Control Plan training will cover your occupational hazards. Biomedical waste and blood-borne pathogens will be presented in tandem. And finally, your sterilization and disinfection requirements will lead directly into your certification for infection control for this year. Let's get started. OSHA stands for Occupational Safety and Health Administration. It focuses on employee safety within the workplace. OSHA was created in the late 80s for the industrial work sector as a means to decrease workmen's compensation claims in the United States. This was when the government made mandatory the use of personal protective equipment, such as steel-toed shoes, lifting belts, and hard hats, to be used within the industrial workplace. Then in 1991, there was a controversial story that broke about a dentist practicing in South Florida who was infected with the AIDS virus. He was presumed to be opening his own bloodstream during dental injections. Consequently, 6 of his patients became infected with the same strain of AIDS. This situation drew national media attention. You may remember this young lady, Kimberly Bergalis, was one of the patients infected with the AIDS virus. She lobbied in Washington before her untimely death at the age of 23. Kimberly made the government realize that body fluid waste was now a threat to both the public as well as employees. This is when the government stepped in and made mandatory the use of biomedical waste sharps containers and red bags within all healthcare facilities to help control the spread of communicable diseases. This was the advent and origination of our current-day blood-borne pathogen rules within the United States. It's very important to understand the relationship that exists between OSHA and the Centers for Disease Control, also known as the CDC. Please keep this clarification top of mind throughout today's presentation. In 2008, OSHA announced that they would be basing their safety evaluations of USA businesses and issuing fines based upon the researched results of the CDC, and that going forward, all researched findings published in any CDC guideline, recommendation, and summary will become the bare minimum standards by which all USA businesses must achieve. This means that the CDC sets the safety standards that are enforced by OSHA as law. Now we are going to talk about our occupational exposure within your workplace. Everyone has occupational exposures. All employees in the dental office have slightly different occupational exposures. For example, the hygienist has a different occupational exposure than the receptionist, dentist, or office manager. In the dental office, we have mechanical, chemical, infectious waste, radiation, respiratory dust, hearing loss, and dental laser exposures. And of course, most recently, COVID or bioaerosol viral exposures. You need to know your occupational exposures. They need to be categorized, rated, be in written form, and signed by each employee. This is a required OSHA document. OSHA inspectors will expect that you have these required employee forms ready for inspection within 5 minutes of them arriving at your office. So make sure all of your employees know where this important paperwork is kept and are able to retrieve these quickly during an OSHA inspection. You will need to have these forms on file for 3 consecutive years for both your full and part-time employees. The first required form is your annual OSHA employee training form. Renewal clients will receive this in an email. New clients will find this in your white envelope within your package. Employees should sign this now or as soon as possible. COVID requires employees to wear respirators during aerosol procedures, and a respirator voluntary disclaimer form is included in our OSHA manual. Remember to locate this disclaimer, make copies, and have all clinicians sign it. We just talked about our occupational exposure per job title. You will need this form on file for each employee specific to their job title. And each employee will need a hepatitis B vaccination record. Michigan requires the original records or a physician's note confirming you had or declined a Hep B series. And Ohio requires a doctor's note if you want to be exempt. Additional vaccination tracking is also now an OSHA obligation to keep on file. You'll need proof of training that all of your team has been trained and certified in the Global Harmonization System. Forms 1 through 6 can be kept all together within your OSHA manual. Our OSHA manual provides a 5-year organizer at the back for easy logical locating and quick access. You will also want to scan and save these important documents. Keep them on a digital or cloud-hosted file with management access only for safekeeping. And all of your employees will need to have a medical history on file. In case there is ever a medical emergency and an employee needs first aid or medical attention, management may choose to have this on file. You may notice we are being really picky about this paperwork, because if you are unprepared or disorganized, your OSHA inspection may become unexpectedly lengthy. You don't want to take the average 30-minute OSHA inspection and turn it into an all-day intensive inquisition. So let's review the required paperwork with a bit more scrutiny. We want you to be prepared, and it's important for all employees to know where these important OSHA documents are kept within your office. Remember, it is required to keep your USA MSDS binder for 30 years as proof of chemical exposure. All staff members should know how to access the working and backup copy of your international SDS libraries. Know where your OSHA manual is kept. It should be written to GHS standards with new hospital sterilization protocols and also house the last 3 years of OSHA employee paperwork. And save all sterilization and disinfection receipts and logs in one binder so that they are easily accessible. Having all of this required OSHA paperwork readily available for an OSHA inspector will help make that inspection run smoothly and be over in no time. In this section, we will shift our focus from employee safety to patient safety, public health, and environmental safety, and discuss the biomedical waste and bloodborne pathogens plan. Let's begin with discussing biomedical soft waste. If you toss soiled waste into the trash, here is where it ends up, and the government doesn't want that. Instead, they require that you double bag your biomedical waste, with the smaller bag being filled and sealed at the point of use prior to going into the larger red bag. For hauler-handled biomedical waste, one large red bag must be kept on premises, and the small red bags must be kept in each treatment room. Small red bags should be sealed prior to leaving the treatment room, then walked down the hall to be placed into the big red bag. Double sealing biomedical waste allows for safer transport of the contents and keeps the degradable waste from putting off noxious fumes as it decomposes. You have a choice when it comes to biomedical waste containment. There are 2 different systems available. Let's see which biomedical waste containment system will be the best fit for your office. Let's compare the 2 choices. You can use traditional red bags, which are picked up by a certified biomedical waste hauler for disposal, or certain states have approved certified mail-back biomedical waste containment systems. With these systems, you place your small biomedical waste red bags and pre-hardened sharps into a rigid, certified safe, larger mail-back container. This mail-back container then gets sent to a central processing center. Check with your state dental board or your dental supplier for details. These mail-back systems are priced up to 30% less when compared to traditional biomedical waste haulers. To review, at the point of use, which means in your treatment rooms, you are required to have biomedical waste containers. You should dispose of all soft waste into small BMW red bags. This safeguards the employee from rehandling the items or contracting infectious disease. All disposable sharps need to be disposed of at the point of use as well. Please do not walk around the office with soiled waste of any kind. Dispose of it at the point of use as is required by OSHA law. Let's discuss your biomedical soft waste in a bit more detail. What should you put into your red bags? Splattered waste or saturated waste? OSHA's own original definition cites that anything sprayed or splattered with blood or saliva should be isolated in a BMW red bag. Since 2008, we have had the requirement that only blood or saliva-soaked or saturated items needs to be disposed of into the BMW red bag. In the dental office, this was limited only to a few items that were saturated with blood or saliva, to include cotton rolls, gauze, cotton pellets, or paper points. During and post-COVID, it has become best practices to contain all patient items that have become splattered or saturated with either blood or saliva. This can include saliva ejectors, patient bibs, splattered clinician gloves. During COVID, best practices will dictate that you remove the patient's soft splattered or saturated waste immediately after seeing each patient. Proper containment and disposal of harmful waste is scrutinized heavily by OSHA and health department inspectors. There are 5 containers that dental facilities need to utilize. Your office may or may not need to utilize all 5. Segregate and properly dispose of your harmful wastes. Non-compliance can merit hefty environmental fines. Distinctions per your dental specialty and state will be provided on your OSHA facility safety checklist. Let's discuss the important distinctions about the proper containment and disposal of your hazardous wastes. Is your office complying to the additional waste disposal laws mandated in 2016? The Environmental Protection Agency, which governs all activities of OSHA and state drug enforcement agencies, passed laws for the proper disposal of pharmaceutical waste in healthcare facilities. to protect their $300 billion soil and water cleanup effort in 2009. Prescription drugs entering sewage systems and landfills were killing the animals. Worse yet, animals were ingesting the pharmaceutical waste, and humans were ingesting those animals. To stop this vicious cycle, in dentistry, to reduce our pharmaceutical footprint on this earth, we now need to use pharmaceutical waste containers. These will house your Class 1 and 2 expired medications, all partially full anesthetic carpules. Residual liquid anesthetic inside of anesthetic carpules should no longer be placed inside of sharps containers or your common trash. These dental pharmaceutical wastes are known contributing pollutants to our water and soil. Partially full anesthetic carpules always need to be placed inside of a pharmaceutical waste container. If your practice offers fluoride varnish application treatments, all fluoride varnish reservoir wrappers and used applicator brushes need to be disposed of in this container as well. Currently, California, Florida, Michigan, and Minnesota require the use of pharmaceutical waste containers at the point of use, which means these states need to have one pharmaceutical waste container in every treatment room. Michigan's legislation may change from point-of-use pharmaceutical containment to needing only one container per location. Check with your state dental board for current guidelines. Keep in mind that current OSHA law requires that all dental offices using anesthetic have at least one of these containers on premises. More detailed information about these containers will be provided on your OSHA Safety Facility Checklist. Also required within dental facilities is the safe and proper disposal of mercury waste. Dentists who either place, remove, or extract teeth with amalgam fillings need to comply. To comply, you must have an amalgam recycling container on premises for the safe containment of the following items: chairside traps, vacuum filters, screens. All of these get amalgam residue on them. Also, amalgam capsules, scrap amalgam, and extracted teeth with amalgam fillings. You cannot dispose of extracted teeth with amalgam fillings into a biomedical waste container or into common trash, because these have to be specially processed. And never put extracted teeth with amalgam fillings into your heat sterilizer in an attempt to sterilize them. Heating amalgam will release toxic vapors. These amalgam recycling containers can be purchased as either a mail-back system or picked up by a professional hauler. Store amalgam containers away from common areas so the mercury vapors will not be inhaled. The contents should only remain in your office for 12 months or less. The Environmental Protection Agency has reported that at least 40% of mercury flowing into wastewater treatment plants start out in dental offices. To reduce the mercury pollution, a recent national mandate has been passed requiring dentists who place or remove amalgam in more than 5% of their procedures need to install a water purifying machine called an amalgam separator. 13 states previously mandated the use of amalgam separators. Legislation concluded in 2017 to mandate these machines for the protection and purification of municipal waters nationwide. The due date to have an amalgam separator in your practice was July 14th of 2020. Fines for non-compliance are 3 to 4 times the cost of a separator, so make sure to comply. Keep in mind that whether you are required to have an amalgam separator or not, you will still need to submit an exemption or compliance certificate with the EPA. Amalgam separators purchased prior to 2017 need to be replaced with updated machines by 2027. Let's review how to set up the 5 containers required to be used within your dental office. You may choose from either traditional licensed biomedical waste haulers or use EPA-approved mail-back containers. Mail-back systems offer significant savings over traditional haulers. For clarification, your dental office should always keep a small red bag or soft biomedical waste mail-back container in each treatment room. Also, a small sharps container or mail-back equivalent used for needles, scalpels, and empty anesthetic carpules. A small pharmaceutical waste container for partially full anesthetic carpules. And yes, you will need an amalgam recycling container, but store it outside of the treatment room so you do not breathe the mercury vapors. Keep in mind that some states require a pharmaceutical waste container in every treatment room. It is important to keep at least one pharmaceutical waste container on premises. And finally, keep a large red bag or large EPA-approved mail-bag container on site as well. You may want to stop this video and take a photo of this screen with a cell phone for quick reference. We will also list these biomedical waste container options on your OSHA Safety Facility Report. Now we will focus on OSHA safety as it relates to your employees and facility. We will now take a few minutes to review your OSHA Safety Facility protocols. You will receive an emailed checklist with all the right answers to help you rectify and implement any areas of non-compliance within your dental office and help streamline your success. Remember to be safe when recapping your needles. Be sure to use the universal one-handed scoop technique, aiming the needle away from your body to scoop and recap, or using a needle recapping device can decrease the incidence of needle stick injury by approximately 90%. Currently, there are 5 states that require dental offices to test a recapping device and keep a written document of the test. These states are New Jersey, New York, Oregon, Tennessee, Texas. If you have the dental enhancements or the dental compliance in a box OSHA manual, you will need to fill in this required document annually. And clinicians, be very cognizant not to pass back anesthetic syringes. The clinician administering the anesthetic must reload and recap the syringe. OSHA inspectors are currently issuing fines of up to $3,000 for this offense. It is a requirement that annually every dental office must test and document that your team has evaluated a new engineering or safety control device and considered its use within your office. Examples of safety device that you may want to consider are blade removers at the point of use, needle recapping devices, and retractable needle devices. While you are not required to implement the safety device that you have tested, you must document that you have completed testing one. Within our OSHA manual, you can find your engineering control testing document. OSHA administrators, remember to fill out this document every year. What should you do if you do have a sharps injury? First, determine if the instrument or needle was soiled with blood or saliva. If no, simply apply first aid. If yes, apply first aid. Check the source patient's medical history to assess risk. You may ask the source patient to have a blood test if you think there is a risk of communicable disease. Employers are responsible to pay for all testing and treatment costs. Also know which treatment center to use and go immediately. You should post the nearest treatment center's name, address, and phone number within your facility for quick reference. If you have a needle stick incident, you will need to document the workplace injury within 48 hours. Dental teams with more than 20 employees are required to report all work-related injuries to OSHA Directory online. Some states like Nevada and Colorado have specific injury treatment center regulations, with which you will need to comply. Also, OSHA mandates that all states report injuries requiring hospitalizations, amputations, and loss of an eye within 24 hours to an OSHA office. If you have our OSHA manual in section number 4, you will find all OSHA injury reporting logs, or you can find these on your online state OSHA portal, and specific injury reporting forms. Contact us when you have a work-related injury for guidance with the specific paperwork and reporting steps. This same OSHA Form 300-300A should be used for any work-related injury, and now if any employee tests positive for the COVID virus or any other future pandemic situations. As each situation will be unique, it is advised to create a written risk assessment to whether to quarantine other employees, deep clean your facility, and notify patients if necessary. Look to the CDC or ADA's most recent guidance that is up to date and posted on their websites. When filling in this form, do not list the employee's name. Instead, list only a private case in the area designated for the name. Management should be vague, stating only that one of our employees has tested positive. Do not be more descriptive than that, as management must keep employee information confidential. Employees may share their health status with others if they choose. If you suffer a sharps injury while at work, you have the right to seek medical attention. It is best to seek help within the first 2 hours of the injury. Injured employees are entitled to all treatment, tests, and medications related to the sharps injury, all at the employer's expense. Testing centers will screen the sharps injury victim for communicable diseases. The two main screenings will be for HIV and hepatitis. Symptoms of HIV include chronic fatigue, weight loss, cough and shortness of breath, chills, fever, and night sweats, and of course, HIV is a concern due to its terminal nature. The symptoms of hepatitis are tiredness, nausea, jaundice, and the one we most want to avoid is chronic liver damage. The initial hepatitis B vaccination series must be offered and paid for by your employer if needed. Even if you, the employee, declines the vaccine, it must be documented. Hep B documentation must be kept on file for all employees, including receptionists and part-timers. Everyone must be offered the Hep B vaccination series. In Michigan, you must have a physician's note confirming that you have had or have declined the Hep B series. In Ohio, you must have a doctor's note only if you decline the series. Your 7-year Hep B titer and booster is highly recommended, but your employer is not required to pay for these. Keep in mind, if you are working clinically, you should get the titer and booster to ensure that your antibodies are induced to protect you in case of a sharps incident. You can obtain your Hep B titer and booster from your physician, a local pharmacy, or walk-in clinic. Practicing with low antibody levels will put you at risk for contracting hepatitis. Clinicians, please make sure to get your titers and boosters every 7 years. The cost out of pocket runs approximately $200. In the CDC's 2016 Infection Prevention Update for dental offices, the CDC states that dental office owners need to share in the responsibility to prevent occupationally acquired infections. To accomplish this, please keep on file for all of your employees documentation regarding their vaccines for hepatitis B, influenza, measles, mumps and rubella, chickenpox, tetanus, meningitis, and COVID vaccination cards or exemptions. COVID documentation should be kept confidential. Copies of other vaccination documents are customized for each of your employees and are included in our OSHA manual. They should be reviewed, initialed, and updated at least every 3 years. 2 COVID vaccination policy templates can be found in your OSHA manual in section number 6. Employers can implement either a mandatory or voluntary vaccination program. We advise mandatory programs to be reviewed with your attorney prior to implementation. Tuberculosis is a disease which had died down for decades, but started getting attention in 2010, with 4 cases being discovered in Florida. Then, in 2014, the CDC reported approximately 500 deaths were related to tuberculosis. In 2021, there were 7,860 known active cases of TB. Take note, tuberculosis within the dental office environment definitely needs to be addressed and prevented. First, when wiping down your treatment rooms, do not use alcohol alone. Make sure you use a medical-grade disinfectant spray or wipe that is tuberculocidin. Follow appropriate contact times listed on product labels. And always use infection control barriers in tandem with tuberculocidins. Exposure to airborne TB within the workplace would hold the employer responsible for providing all potentially exposed employees a medical TB test. Your office will be responsible to have a written protocol for how you will handle patients or employees who you suspect may have been exposed to TB. Filling out the last pages of CDC's infection prevention packet will fulfill this obligation. A copy of this packet is available within your OSHA manual. All employees hired after January 1, 2018 will have to provide a TB test with results posting as negative before they can work within your dental office. Most chain pharmacies can perform this test. The average cost is under $50. The employer is responsible to cover this expense. Now let's review more general OSHA safety facility requirements for your workplace. Employees need to be educated on fire safety and emergencies. Have a professional fire extinguisher inspection annually, and you will now need to document monthly self-inspections on site. Make sure that all exit signs are illuminated and that you have no burnt-out light bulbs. Have an emergency exit drawing posted within 3 required areas of your office. And make sure everyone knows where the designated meeting place is in case an office evacuation is necessary. You must also make biohazards known within your dental office. OSHA inspectors will check to see that you have posted these biohazard stickers on all suction trap caps. If someone tries to open these, they could end up in contact with mercury, blood, or saliva. A danger or radiation label should be placed at all X-ray buttons, on all cold sterile and ultrasonic solution containers, at the compressor room door, and at your laundry, hamper, and washer lids. Please ensure that your team is current in CPR, AED operation, and first aid. Additionally, we will review your OSHA manual to ensure it has written plans that cover safety, first aid, and all required OSHA protocols to include that you have a working eye wash station with signage. You must test your eye wash station and document that it is working weekly. A spill kit on premises to clean up biomedical waste, chemical, and mercury spills. And also that you have an AED and oxygen or resuscitation device on site. AEDs can be state required and are also the ADA's standard of care that will protect your practice from liability in life-threatening situations. Make sure you have a working defibrillator in your dental office with batteries and pads that are not expired. All clinicians should know how to utilize the AED. Most dentists, hygienists, and licensed or certified dental assistants cannot renew their licenses without this training certificate. Your first aid kit should have these items at a minimum: aspirin, antihistamine, an EpiPen, sugar icing in a tube or glucose. Resuscitation devices are a Michigan requirement. Dentists are not required to have injectables on site, but if you do have injectables, then all doctors must be trained to administer and use them. Please store your dental products and food properly, either inside of a separate refrigerator or on a separate shelf or container labeled Dental Products Only. To make sure that all of your OSHA-required posters are up to date, you should include Whistleblower Protection Policy that provides anonymity to any person wanting to report an OSHA violation. The 2017 poster updates for anti-retaliation or no tolerance for bullying within the workplace. And if your state is listed in white, there was an update to your OSHA poster in 2022. If your state is not listed, please check to see if you have had any changes in 2023. You can download your OSHA posters for free at osha.gov or purchase all-in-one laminated type OSHA posters that are available online. Make sure these are specific to your state, and don't forget to post all required labor laws and Hippa posters too. Please note that any eating is prohibited in all healthcare facilities. You can only eat or drink in a designated lunch area. What should you do before letting an OSHA inspector into your back office area? Keep in mind that your inspection will not begin until the OSHA inspector steps into your working area. This will give you a few minutes to prepare while they wait in your reception room. Make sure that all food and drink are only in your designated lunchroom, and that all new team members are wearing the proper PPE. Clinical team should have on protective eyewear, face shield, clinical gloves, a respirator, and long-sleeve lab coat. Non-clinical team members should wear a surgical mask and a long-sleeved lab coat. Please note that wearing long-sleeve shirts under your scrubs is not OSHA acceptable. Michigan has additional protocols for specific type lab coats. The ADA and OSHA signed a formal alliance in April 2004, providing better working conditions for dental employees with a specific focus on ergonomics. Ergonomics is the science of safe posturing and movement to protect an individual from musculoskeletal disorders. OSHA provides guidelines, and the ADA provides profession-specific advice for your safety within the workplace. Ergonomic at work is important. Be sure to employ proper posture techniques. Distribute your weight evenly without leaning or crossing your legs when seated. Sit straight with your back against the back of your chair whenever possible, and avoid leaning forward with your neck or shoulders. Dentists and hygienists. Be sure to have patients turn towards you during clinical procedures and work at the proper operator's positions. Dental assistants. Be sure to allow yourself the proper amount of legroom on your clinical seats. With dedicated focus, you can stay properly postured for the course of your career. Do make sure to remind each other to sit correctly. Take stretching and breathing breaks. Get a chair checkup for proper posturing. and learn dental yoga, which includes ergonomic posturing, stretching from your dental chair, and deep breathing techniques that will keep you healthy and stress-free in your daily routines. Remember to properly manage areas where moisture and electricity meet, around autoclaves and ultrasonic cleaners. Do not overload these circuits, do not use extension cords, and always use grounded 3-pronged plugs. Inspectors will check these areas. If you notice any other unsafe areas inside or outside of your dental office, please make sure to report these to management so that any hazards can be rectified and your team can stay safe while at work. Log-out, tag-out labels may be a new addition to your OSHA protocols. These tags need to be placed on equipment, including handpieces that become broken and in need of repair. This will alert employees to steer clear until repairs have been completed. It is required to have the name of the person in charge of the repair listed on the back of the tag, adding the date and what is wrong with the equipment. Order log-out, tag-out labels from your dental supplier or find them in the back pocket of your OSHA manual if you purchased one from Dental Enhancements or Dental Compliance in a box. OSHA inspectors will check that your team knows how to use these labels. Other OSHA protocols that inspectors will look for include Whistleblowers Protection Law, which should already be posted in your office. This law explains that any workplace OSHA reporting will always remain anonymous and confidential. Also post and adhere to retaliation protection policies within your workplace. This anti-bullying law protects individuals from unfair treatments with harsh penalties for offenders. OSHA requires that your team hosts a quarterly safety meeting. They do not require any sort of format, just that you log the meeting. The info we provide can serve as your quarterly safety meeting topics. You can also check out our website for updates or reference and read the yellow highlighted areas on your OSHA facility report or your OSHA checklist. One final safety note. Make sure to assign an OSHA key contact person at your office. Your entire team should know who this designated OSHA key contact is and where your OSHA manual and important paperwork is kept. Module number 4. This section will provide your team with an updated focus on infection control as we discuss the sterilization and disinfection rituals required to accomplish the hospital-grade standards within your dental workplace. There are 4 areas that must be monitored and tracked with documentation within your dental office. First, if you use a traditional biomedical waste hauling service, make sure you have biomedical waste removed at the proper 30 to 90-day intervals based upon when your office produces saturated waste. The biohazard waste pickup receipts will need to be saved for 3 years. If you use new mailback biomedical waste containment systems, you must keep a log tracking when they leave your office. Mailback logs should also be kept on file for 3 years. If you use cold sterilization solutions in your office, then you must keep a log or calendar that serves as written proof of when you change the solutions every 21 to 28 days, per the manufacturer's recommendations. This year, dental chair water testing requirements get much stricter. All dental chair water lines are required to be shocked and tested. Water quality needs to test below 500 CFU per milliliter of heterotrophic mesophilic bacteria. These are acceptable OSHA and EPA levels. The ADA's ideal level is 200 CFU per milliliter. If you used a closed bottle system, there are 3 steps that need to be executed and documented every 90 days for each dental chair. We will review these 3 steps in more detail in a few moments. Make sure to take notes. If you use municipal water in your dental chairs, testing and shocking is required every 7 days for every chair. Documentation must prove each chair has the acceptable water quality. Direct water lines are nearly impossible to sanitize or shock, leaving your water test results at subpar levels. This is a good time to consider updating all municipally supplied dental chairs to a closed bottle system. It will make monitoring, testing, and documentation of your dental chair water quality consistent, reliable, and effective. Heat sterilizer monitoring should be done through a third party at least weekly in most states. And now going forward, dental offices will need to monitor and confirm that every sterilizer batch is in fact sterilized. In 2016, OSHA adopted the Center for Disease Control's update on infection control and disease prevention for dental offices as the basic expectation safety standards. These new doctrines were designed to accomplish a surgical grade level of sterilization and disinfection in all dental office settings throughout the USA. They are regarded by OSHA as being the bare minimum OSHA law for all dental facilities, especially in light of dentistry's recent pandemic pivot to hyper-focus on infection control. This CDC and OSHA law summary will update your dental office to understand and implement the new requirements for surgical grade level of sterilization and disinfection. This is a 44-page document. Your team will need to read pages 4 through 16 during a staff meeting, then fill out pages 19 through 35 to reflect the new protocols as part of your daily practice. This CDC summary is required to be part of your written OSHA protocols. It is included as the second to last section of your OSHA manual that you may have purchased through Dental Enhancements or Dental Compliance in a Box. What will change? Just about everything. Make sure you understand in detail the specifics for universal/standard precautions that protect the patient and employee from cross-contamination and include the following: hand hygiene, proper use of personal protective equipment, especially during COVID, a respiratory hygiene and cough etiquette program, sharp safety and safe injection practices with written policies, proper surgical grade sterilization and disinfection protocols for treatment rooms and all patient care items, and infection control written policies to pandemic protective standards. And also proper protocols that demonstrate that your dental unit water quality is regularly tested, shocked, and documented as being at acceptable quality levels. Let's review these standards now in a bit more detail. Specific changes will demand your team's full attention and compliance with a 4-step heat sterilization process to accomplish surgical grade level sterilization, handpiece sterilization after every patient to include all turbine and especially all slow-speed motors, the 3 steps required to achieve safe water quality at every dental chair, and special attention to proper usage of personal protective equipment. Let's go into more detail about these changes now. Going forward, your dental office will need to include these 4 steps to accomplish surgical grade level sterilization. First, all instruments will need to be bagged or wrapped cassettes. Next, the date they were processed needs to be clearly marked on the wrapping. Use a non-smear ink or a rolling stamp. The third step requires a third-party spore test company provides you with a written report on spore kill rations weekly. But let's face it, if you have a passing grade on your third-party spore test one week, but then a failure the next week, this opens up a huge margin for error, because you would not be able to discern for an entire week which instrument packets were sterile or contaminated. This poses a huge quality control issue. To remedy this, you must now monitor and track this using a multi-perimeter indicator spore strip in every processed load. Will confirm that time, temperature, and pressure are met. Traditional heat-sensitive tape or bags only measure that temperature was met. Using a thermal printer or multi-indicator bags are also acceptable. This step establishes a tighter margin for error when monitoring sterilization, and you will be able to monitor the quality control of your instruments from batch to batch, not week to week. This step elevates your quality control when processing instruments to the surgical grade. This may be new to your team, so be open-minded. You may resist it at first, but after a week of this routine, you will get in the groove. We will list these required sterilization steps on your OSHA facility report or OSHA checklist. Let's look at 3 options to achieve multi-perimeter sterilization. These are multi-perimeter indicator strips. 1 strip gets placed in the center of each sterilization load. They are affordably priced from dental suppliers. You get 250 strips in a box for approximately $20. We like the OK Steam Indicator Strips brand. They provide an OK indicator if the sterilizer is working and a 0 indicator if the sterilizer is faulty. An alternative to using strips is to use a thermal printer. Many heat sterilizers are pre-built to accept printout roll tape, or you can purchase an external thermal printer. Most are priced at $700. You can purchase multi-perimeter sterilization pouches. Their cost is approximately $1 more per box than traditional pouches. Keep in mind that traditional pouches only change color when sterilizer temperature is met. Multi-perimeter pouches will change color only after time, temperature, and pressure measures have all been met. Your multi-perimeter monitors are considered official OSHA tracking documents. You will need to indicate the date and time of the load on the indicator strip, and then retain these monitors for 3 years. To save them, you can either tape your strips in chronological order into a 3-ring binder, or place them into a Ziploc bag labeled by month or quarter and year. For thermal printers, just save your printed out rolls. Additionally, all handpiece components need to be heat sterilized after every use. This applies to high-speed turbine handpieces, autoclavable profile angles, contra angles, and most importantly, low-speed motors. OSHA inspectors follow this formula to ensure you are implementing surgical grade levels of handpiece sterilization. They will count the number of handpieces, the number of clinicians, and the number of patients seen per day at your office. The ratio of handpieces per treatment room should be 3. This accounts for having 1 handpiece in use, 1 in the heat sterilizer, and 1 in a cool-down process. Please note this distinction. Traditional turbine high-speed handpieces and low-speed handpieces need to be heat sterilized. Check with your manufacturer of your low-speed handpiece to ensure it can go through heat. Many older models may need to be retrofitted to handle the heat cycle. More modern wireless hygiene handpieces and electric high-speed handpieces are hermetically sealed and only require wipe down with a disinfectant agent after use. Please update your handpiece sterilization procedures to comply with these new OSHA requirements. You can find complete information on page 12 of the CDC summary for dental practices. Now let's discuss the updated dental chair water quality requirements for all dental chair units. The new era of OSHA and Hippa inspections. Are you prepared? Dental chair quality is being highly scrutinized. Direct municipal water is very difficult to regulate, so now is a perfect time to consider making the move to bottle reservoir systems. What should be happening with your dental chair tubing and bottle reservoirs? The answer is absolutely nothing. This water now needs to be monitored, treated, supertreated, tracked, tested, and your results will need to be documented for every dental chair every 90 days. The enemy here is biofilm buildup. The CDC has found that historically, dental chair water has gone undertreated or ignored. Now it is a proven fact that dental chair water, biofilm, has been found to have negative health implications in the children, the elderly, and immunocompromised. So understanding your obligations to disarm biofilm buildup within your dental chair water lines is critical, as specific routine protocols are now OSHA enforced. Let's review some important historic events that had significant impact on why dental chair water lines are so closely scrutinized by inspectors. It all started with Mimi. Mimi was a 7-year-old girl who kept visiting the emergency room in Anaheim, California. She returned repeatedly with severe jaw pain and infections. This outbreak was traced back to a Southern California pedodontist chain of practices. Needless to say, it spurred lawsuits, trials, and eventually, the pedodontic chain was forced to shut its doors. This situation was also reported in Atlanta, Georgia, involving 30 patients. The recurrence prompted the new crackdown and update to the OSHA requirement to ensure that dental chair water quality is safe for all patients. One particular doctor was on call in Anaheim, started to recognize a pattern. Over an 18-month period, 250 kids presented in the Anaheim emergency room. Of these, all were hospitalized and required surgical debridement. 45 had to have teeth extracted or jaws resected. 26 had more than one surgery. One infectious disease doctor discovered the common thread that held these cases together was that all children had visited the dentist and had pulpotomy procedures within an 18-month period. These are the 3 steps all USA dental offices now need to take to ensure that their water is up to current standards. Keep in mind, to accomplish these water quality standards, a bottle reservoir is essential to flush and disinfect the water lines. Now is a sensible time to convert all direct municipal water sourced lines to closed bottle reservoir systems because it is nearly impossible to flush and disinfect direct municipal water lines. Let's review the 3 OSHA requirements to establish safe quality drinking water from each of your dental chairs. First, add a daily treatment to your water. Use EPA-approved filtration systems or inside of bottle reservoirs. Use purification tablets, drops, or Asteristics. Next, you will need to purify all of your water lines by shocking them. This is required once every 90 days for bottle reservoir systems and weekly for direct municipal lines. There is no clear-cut way to add a shock treatment to municipal lines. Lines and hoses that are required to shock and purify include your handpieces, air water syringe, Cavitron water, line suction, hoses, and bottle reservoir. Immediately after your shock session, your water lines will be at their cleanest. Now you must test each dental chair to ensure your water is at drinkable quality levels, then document the results. We will list water test kit information on your OSHA recap report so that you can order them from your dental supplier. They come in single or multi-packs. Remember to order enough kits so that you can test each chair 4 times per year for reservoir systems and at least weekly for direct municipal lines. Water testing results need to be documented and saved for OSHA inspectors. Testing companies will provide your results in written or email format for you to save. This instructional sheet that is included in the back pocket of our OSHA manual provides step-by-step instructions for shocking your water lines. Keep in mind that your suction does need to be turned off for approximately 1 hour to accomplish this step. No patients can be seen during this water shocking process. To shock your lines, either mix a solution of 1 part bleach diluted in 9 parts water, or for a less corrosive option, purchase a professional shock solution. Reach out to the professionals to get answers in more detail about all of your dental chair water quality requirements. Respirators or masks should be worn by all clinical personnel exposed to aerosol procedures. Need to wear NIOSH N95 approved respirators or an equivalent. Respirators need to be properly fitting and in ample supply. Each employee needs to sign a disclaimer form indicating that they know the risk and benefits of wearing a respirator and that N95s have passed an initial and annual fit test of their respirator. If wearing a respirator is questionable for any clinical employee, the employer should offer a medical assessment be completed by a physician. The employer should then write up a risk assessment of that particular employee's contraindications and decide on their permissible work duties. Soiled respirators need to be disposed of into BMW red bags. Administrative personnel should wear surgical masks while in the dental workplace if COVID rates are elevated in your community. Clinical personnel working in non-aerosol procedures should wear level 3 surgical masks or better. Make sure these are snug-fitting with medical strips molded to fit over the nose and chin. The mask color should be facing out with pleats facing down. Surgical masks should be changed frequently per manufacturer's specifications. Protective eyewear needs to be large enough to cover your eyes and have side shield protection. Do not take shortcuts by wearing your own glasses alone. Inspectors will check for side shield protection. Use disposable eye shields and protective face shields if you wear loupes or prescription glasses at work. Gloves that are too small create too much pull on the thumb to palm area, pulling the thumb back in an unrelaxed, unnatural position for long periods of time. Wearing ill-fitting gloves has recently been related to the most common chronic occupational injuries such as nerve damage to the thumb, carpal tunnel, and trigger finger, especially for hygienists. Try non-sterile fitted gloves in sizes 5.5 through 9. They are more affordable than you think, and they will save your hands for a lifetime of good health. And remember, all employees who handle soiled instruments need to have their own pair of puncture-proof utility gloves. Before COVID, scrubs were considered a uniform and permissible to be maintainable by each employee outside of the workplace. But since COVID, it's considered best practices to change and launder scrubs at the work facility if possible. Lab coats are considered to be personal protective equipment. All employees must have access to a clinical lab coat. You have 3 choices when it comes to proper maintenance of your lab coats. You can launder lab coats on site, have them picked up by a designated biomedical waste laundry facility, and keep receipts as proof of laundering, or keep disposable lab coats on hand for all team members. Until further notice, employees involved in aerosol procedures need to change their lab coats after each aerosol procedure. Remember to wear sturdy, full-coverage shoes and leave them on site. Hearing loss is the #1 occupational hazard in dentistry for clinicians over 50. For prevention, always remember to maintain the maximum distance from your handpieces. Lubricate and maintain all handpieces regularly and properly. Use custom-made or disposable hearing protection devices. We like erasers, which muffle out high-pitched sounds but allow conversations in. Congratulations! You have finished all 4 of your OSHA-required modules for this year. Prepare to watch just one more required module that will update your knowledge on Hippa patient privacy and data security within your dental office facility. This section will provide your 2023 Federal HIPAA Employee Training Module. HIPAA laws protect the privacy of your patient's health-related information. It puts responsibility on the healthcare facility to protect and secure all identifiable patient health information. This is referred to as PHI, or Protected Health Information. There are 18 common protected health information identifiers. Your team should probably use 1 through 10 daily, and maybe even 17. We have to safeguard all PHI, keep it safe, private, and confidential, especially when 3 identifiers are available simultaneously: a social security number paired with a date of birth and full name. Identity thieves are targeting dental and medical facilities, trying to obtain this PHI trifecta by stealing unprotected servers, laptops, and take-along backup drives. All of this information should be covered in detail in an annual HIPAA Employee Training Update class. It is important for all employees to understand what constitutes as a HIPAA breach. All healthcare employees are responsible to know what a HIPAA breach is and understand the steps that need to be executed should a HIPAA breach occur at your office. A breach is an impermissible use or disclosure of patient PHI that compromises the security or privacy of that PHI. There are 2 kinds of HIPAA breaches. A minor HIPAA breach involves less than 500 patient files. Example of minor HIPAA breaches would include sending or giving a patient the wrong invoice, emailing, texting, or faxing PHI to the wrong party, gossiping or employees sharing PHI inappropriately, disclosure of PHI to unapproved third parties, leaving office computer screens or documents unattended for other patients to view or obtain PHI. Examples of major HIPAA breaches involve more than 500 patient files being compromised. Examples would include hackers penetrating through office firewalls, opening email attachments with viruses that purge patient data, loss or theft of devices, sending and keeping unencrypted data, and the improper disposal of patient records. What is the best way to avoid having HIPAA breaches occur within your office with your patient PHI? Train all employees before they handle your patient PHI, and then at least annually on your HIPAA protocols. Have routine meetings to review and update your HIPAA protocols. Discuss examples of possible breaches. Write new protocols for how to mitigate such occurrences. Use PHI minimally, as necessary, then keep it stored securely and protected. And understand PHI possible breaches and HIPAA reporting protocols. There are several steps that need to be followed if you suspect a HIPAA breach has occurred with your patient PHI. First, evaluate the situation to determine if your facility has experienced a breach with your patient-protected health information. Next, reference and fill out this 4-factor breach assessment form, which can be found in our HIPAA manual or on our HIPAA portal. You can also call the HIPAA coaches at Dental Enhancements for guidance. This form will help you to determine whether you are dealing with a major or minor HIPAA breach, and this will impact your next steps. Minor breaches affect less than 500 patient files, and major breaches affect more than 500 patient files. In either case, you will need to fill out this form and retain it on file as evidence that you are treating the situation properly. Next, you will need to contact all affected individuals to notify them of this situation and the extent to which their protected health information was compromised. This must be done verbally, in writing, and delivered within 60 days from the day that you discovered the breach. Breaches involving more than 500 individuals will require that you contact media to announce the breach as well. Creating a press release regarding this situation and emailing or faxing it to newspapers, radio, or TV stations is proper protocol. Retain a copy of your press release as evidence that you are properly handling the situation. You will also have to report this HIPAA breach situation to the U.S. Department of Health and Human Services. Find them on the web by searching How to Report a HIPAA Breach or go to hhs.gov. There will be specific links for reporting minor and major breaches. Call the coaches at Dental Enhancements or an attorney for more guidance. What does this mean to your dental office? We know that you must protect your patient's protected health information to strict HIPAA privacy and security standards. This applies especially to your computer and internet activities. But also you must ensure that your facility standards have been updated to include proper HIPAA security for emails, texts, copy machines, fax transmissions, unique passwords for all employees, updated employee job descriptions written to the current HIPAA standard unique entry monitoring at your facility, and adherence to COVID confidentiality. HIPAA standards are constantly evolving. In November of 2016, the U.S. Department of Health and Human Services began to conduct an on-site medical and dental office HIPAA audits. Audits can be random, initiated by patients or other professionals, and can even be sourced from improper social media posts using patient PHI. If you are chosen for a HIPAA audit, you will be sent a notification by email or letter from HIPAA officials with a 10-day response notice. HIPAA audits can last up to 18 months and bring fines from a minimum of $10,000 ranging to up to $600,000. Dental offices need to prepare with facility updates and safeguards. Here is what HIPAA auditors will be looking for in your dental office. There are approximately 25 facility requirements to comply with under the HIPAA Omnibus rules. From providing privacy during patient checkout to using HIPAA-compliant text apps, HIPAA secure fax and email services, setting your practice software to HIPAA privacy mode, and ensuring your Windows programs are current to Windows 10 format. Make sure your server is secured or in an isolated area. Understanding the importance of retiring take-along backup drives and using reliable cloud-encrypted data backup services. Detailed documentation of all of this is also required by updating your HIPAA manual annually. You will need to provide an annual update for HIPAA employee training with proof of updated training documentation. And most importantly, have your required HIPAA reports updated and readily available. It is important to look at 5 authorities that dictate current HIPAA laws. Department of Health and Human Resources works in tandem with Office of Civil Rights to establish federal HIPAA law. But there are 3 other entities to look to within your state that can dictate stricter HIPAA regulations. They are your Governor's Office State, Dental Board, State Health Department. Always follow the strictest ruling as minimum standard. Another critical HIPAA standard is to understand PHI sharing restrictions and allowances during pandemic situations. While Health Department and other government agencies can request patient and employee PHI during pandemics, The employer is responsible to keep employee or patient PHI confidential. The employer does not have the obligation to inform individuals who may have had direct contact with the positive testee of the situation, but it must be communicated without revealing the positive testee's identity. Positive testees and vaccinated employees can share their results with others if they choose, but employers, management, or other employees cannot. Teledentistry has been around for several years, but has gained more notoriety during the recent COVID pandemic. Teledentistry uses phone or internet interface to provide photos or video of patients' dental concern that is shared with a dentist in a remote location. The dentist examines the video or photo to determine the problem. Next, the dentist may prescribe medication to help with discomfort until the patient can obtain an in-person exam or treatment. In many instances, teledentistry provides a quick, convenient type of examination and may offer the patient more immediate relief. It can also serve the physically restricted and remote patients more easily. Teledentistry should continue to remain useful as we move into our new era of dentistry. But it is important for you to check with your state dental board to see if teledentistry is permissible in your area. We have been talking about a lot of HIPAA requirements, and the government does require that your facility provides an in-depth report acknowledging that you are abiding by the current HIPAA standards. To fulfill this obligation, we offer an easy-to-use risk assessment report template. The required security risk assessment report will be one of the first things that a HIPAA auditor will ask for when they inspect your office. No need to worry, we will offer this update report to you annually. If you need to purchase the HIPAA report template, be sure to contact us after this video. All you'll have to do is abide by any annual HIPAA updates, print out the report, and keep it on file within your HIPAA manual. Now let's review all HIPAA Omnibus Rule required forms. Is everyone doing all right? We have about 10 minutes left. Hang in there. Currently, there are 7 HIPAA forms that you should be using within your dental office. An updated patient acknowledgement form. All patients will need to sign this one. A business associates agreement for all business vendors who see or use your patient info. The notice of privacy practices needs to be displayed within your office and posted on your website. If you accept Medicaid or Medicare or Healthy Kids programs, there are additional notices and policies to be posted within your facility. Each employee will also need to sign 3 HIPAA-required employee forms. After viewing this video, please see your compliance administrator to complete your HIPAA and OSHA-required forms. So let's finish up by looking at these forms in more detail. With the new HIPAA Omnibus rules comes a lot of paperwork too. Currently, 7 forms should be updated and in use in your dental office. Be sure that you are using an updated patient acknowledgement form, as all patients will need to sign these. A business associates agreement for all business vendors who see or use your patient info. A third-party medical release form for any third parties who want to pick up records or x-rays for your patients. The notice of privacy practices needs to be on display within your office. Make a reception room copy or create a few clipboards with a laminated version on it for patients to read. And also add this notice of privacy practices to your website if you have one. It's the law. Finally, whether you are viewing this training as a team or individually, it is required following this presentation that all employees sign 3 various employee training and confidentiality agreements that proves HIPAA training has been completed and each employee understand all confidentiality compliance requirements. Make sure to see your HIPAA compliance training manager to obtain your HIPAA and OSHA required employee forms. We will finish up this HIPAA module by viewing these HIPAA forms in a bit more detail. Let's take a look at the HIPAA form. All of your patients will need to sign the HIPAA Patient Acknowledgement Agreement. Your new patient acknowledgement form is written to the Omnibus Rules standard. Look at all of the allowance you will get with just one patient's signature. First, your patient can determine how they wish to be summoned by name within your office. Next, they can designate which individuals can have access to their records. This is very important to have on file, especially for step-parents or other caretakers who may request billing, appointment, or other important confidential information. Then they can designate treatment or financial and contact methods that they prefer. This one is new, fundraising practices. Your patients must have the option to opt out of text and emails with regards to fundraising efforts within your office. Also, this is a polite way for patients to opt out of text or email messages if they choose. You must address product selling practices within your practice. Please include this if you dispense any products to your patients. Having all of these acknowledgments on one form will streamline your omnibus rules. HIPAA Business Associate Agreements, or more appropriately called, a Business Vendor Confidentiality Agreement. HIPAA is designed to safeguard the patient's protected health information, or PHI. In HIPAA terms, your healthcare facility is considered the covered entity. Now, under HIPAA protocols, your business vendors and even their subcontractors all must sign a business associate agreement as a pledge to keep all of your patient PHI confidential and protected. Your business vendors will now be held accountable to protect your PHI. Vendors who see or handle your PHI during the course of their duties must sign a confidentiality agreement called a HIPAA Business Associates Agreement. You can use the log located within our HIPAA manual to create a list of your business vendors who will need to acknowledge and sign a BAA with your office. Vendors that are required to sign a business associate agreement would include confirmation services, consultants, and IT techs, data storage and software companies, shredding and confirmation services, and dental supplier services. It is highly recommended that vendors who can view or use your PHI also be included. These vendors would include temporary employees, volunteers, students, after-hours vendors, and service companies. There are several vendors who will be exempt from signing a BAA because their relationship with you is considered to be the course of doing business. These would include referring doctors, pharmacies, labs, credit card companies, insurance companies, and mail delivery personnel, who are by law bonded and insured. Your office's notice of HIPAA privacy practices should also be updated and available for viewing. Your HIPAA notice of privacy practices is required to be displayed within your office, on your website, and offered to all of your patients. We think the best way to display your notice of privacy practices within your office is to copy it, place it in a clear plastic page protector, and attach it onto a clipboard. This way, when a patient fills in their updated patient acknowledgement form, they can see the notice of privacy practices on display right on the clipboard. Or you can just display within your reception area. If your office is paperless, an electronic copy can be scanned and stored within your practice software for review. Also, under the Affordable Care Act, Section 1557, if your healthcare facility gets government reimbursement for Medicaid, Medicare Part C, Medicare Advantage, or state-funded Healthy Kids programs, then you will be required to post and use 2 notices within your practice: a non-discrimination notice and taglines on office forms that reference free language translation assistance will be provided by your office as needed. The U.S. Department of Health and Human Services provides a free translation resource for you in 15 languages. You can search for this link by using the keywords HHS Language Assistance Services, or by following the link that we have provided in your HIPAA workbook on the Healthcare Reimbursement Requirements Affordable Care Act Section 1557 page. The required non-discrimination and translation taglines must appear in your office, on your website, and on office postcards and brochures as a shorter version, your state's top 2 languages. If your healthcare facility receives these government reimbursement programs, be sure to reference our Section 1557 posting worksheet in your workbook. All of the aforementioned forms are available to you within your HIPAA manual or in digital format on your HIPAA portal. HIPAA is not going away, and failing to prepare will only prepare you to fail. So what will you do? Choose to get hip to these HIPAA Omnibus Rule updates. If you practice in Texas, please remember that Texas requires an additional HIPAA module called Texas HB 300, which is required to be updated by all employees every 2 years. Make sure to complete your Texas HB 300 video training and required paperwork if you have received this from Dental Enhancements or Dental Compliance in a Box. Call us for more info if need be. To ensure your facility's ongoing compliance, your membership provides automatic enrollment in our annual OSHA and HIPAA Renewal Rewards program. During your upcoming administrative support session, your compliance coach will secure your pre-reserved session for next year, locking in your pre-booking discounts. Or if you're utilizing our Dental Compliance in a Box do-it-yourself option, be sure to contact us to ensure you are enrolled in our automatic renewal program. Congratulations! Your team is now certified for this year in Hippa, GHS, and annual OSHA employee requirements. Should you have any additional questions or to order updates, please contact us via the email or phone number listed on your screen. Thank you again for choosing Dental Enhancements or Dental Compliance in a Box. We are dedicated to your compliance success.